Ladies and gentlemen, you're most welcome to this session. It's the last session for this convention. It's a very, very, very interesting topic that we're going to discuss here on healthy homes. With the growing need for home care, we need to ensure that we not only focus on affordable housing, but also healthier living with adequate lighting, ventilation to outdoor quality. Most African governments really focus on providing affordable housing. Miranda, having worked with the Malawi Housing Corporation as the chief architect for over 10 years, what is the current public housing situation in Malawi, especially for low-income households?
The situation in Malawi, just as many African countries, is dire. For the low-income households, we have statistics which is dating to about the last 5 to 10 years, where low-income households need about 21,000 units for us to meet the demand. These 21,000 units must be built every year. And as in almost most sub-Saharan countries, you will find that most people, the general population of the cities is housed in the shanty towns, where they live in very unhealthy conditions with unplanned roads. The housing situation cannot be classified as being healthy according to the standard of occupation that we have. So that's the situation in Malawi. Though the government is doing quite a lot. It's reaching out to this lower income level by producing materials. They give materials as a subsidy to these low income households, both in urban centers and also in the rural communities. We have a flagship project, which we call Decent and Affordable Housing Program, which has been running since 2014, and it's still running up to now. It's reaching out to these communities. That's what I can say in a nutshell. But there's a lot of need. There's a need to lift up the lives of people in the urban centers, in the cities. There's need.
Miranda, thanks for that. You've talked about 21,000 units every year. For how long has this been happening? And is this not enough for the population that is in dire need for houses? 21,000 units per year.
These 21,000 units are just a plan. The government or even the private sector has not been able to reach the 21,000 units. Using like the Malawi Housing Corporation, which is the main agency for construction of houses, provision of housing in the country, they've only been able to produce like hundreds a year. And the private sector, if you consolidate everything, we're putting into the market not more than 1,000 in a year. So you can see the disparity in the figures. If we were able to meet the 21,000 units for the past 6 or 7 years, then the situation would have started improving greatly.
Then everybody will have a home, isn't it?
Exactly.
What about improving existing houses that are dilapidated, like you're talking about, for lack of a better word, shanties? Maybe Dr. Kibue, from your recently completed post-occupancy evaluation research on both formal and informal low-cost housing initiatives here in Nairobi, what are the key aspects for safe and healthy homes environments?
Well, the first thing that we checked when we were doing our survey, our research, was to understand what perceptions people have about housing. And what was very important in our study is that we found that people who had been involved in the housing were really able to look after it better, to clean it better, to take care of it better. And with that in mind, it means that the houses are more healthy. And also, when you're talking about healthy homes, we are talking about not only the presence of the house, but also what's happening on the outside. So they're also able to take care of the play areas on the outside. They're able to keep them clean. They're able to take care of your children who are within those play areas. Yeah, because we did a comparative study between two houses, two housing projects. One that was delivered by the government, and one that was done by the people themselves. Yeah, it was a case where people have put in their own resources to provide themselves with housing. Yeah, it's a slum in a place called Huruma in Nairobi. And from our perception study, we found that the ones who were from Huruma They were very happy with their housing. They took very good care of it. They were very proud of it. And even in the design, they were able to provide all the things that the tenants were talking about for healthy housing. They've got proper ventilation. They've got enough windows, large windows. They've got little courtyards in between the housing, the way they have been put together, so the children can play safely, and they were able to keep those ones clean as well. Yeah, so that sense of pride in a house is very important in the sustainability agenda, in taking care of something. It's just like how we have our own houses and how we are so proud of them and how we really look after them well. And that is very important. So in the government build housing, which we looked at in Kibera, it was a high rise in Kibera, we found that the people who were there that we interviewed, they were not really they were not really very interested in taking care of the place, because it was like, common land everywhere. Even what is in between is common. I mean, so bad that they were even dumping rubbish in the sewer, which is just
that sense of ownership. That sense of ownership was lacking.
Was lacking. So I think it's very important that we found out that the perception is very important for how people feel about their housing, but they have to have a stake in it. They have to have a stake in it. So
let us just go back to Huruma. Sorry to interject.
Yes.
Where the locals were involved, and so to speak, they made their houses healthier compared to the ones that are provided by the government. Who was behind all this initiative in your study?
In our study, it is the people themselves. The people are.
How did they decide? I mean, how did they decide that our homes are not healthy? They are not architects, I'm sure. How did they decide that? What was the motivation behind all this?
You see, Kambimoto in Huruma is actually called Kambimoto, which, if I can translate, it means a camp of fire. By a camp of fire, it means that very often their houses would because it was slums, with any residual materials, or putting the houses together, cartons, piece of, iron sheets. They put anything together to put up a house. So they were prone to fires very often.
Okay.
Yeah, that's why it was called Kambimoto. Kambimoto means a camp of fire.
Fire,
so
yes.
They even called the place a camp of fire, because every other time there was a fire. I mean, when you're going from home, or, you're just told, you come and find your house is burnt down, you have to go to your neighbors or something. So they came together themselves. So what really impresses about this is that is what the resource in the people themselves in putting together something in order to provide for themselves somewhere to live, somewhere decent to live. So it was very interesting.
So it was also a very important research that you conducted.
Yeah.
Tukumni, now that we are talking about research, give us a brief highlight on the importance of housing research during this health emergency.
I feel that housing data research in general is important, specifically to provide information on housing profile, compiling data on land tenure systems, availability of rental housing options, housing financing and land availability, especially if this is conducted in collaboration with reliable sources, such as national statistics offices. It is extremely important. I feel this is to ensure easy access to housing information, and in some cases, it can also guide to prevent forced evictions, for example, especially due to maybe mortality rates in the pandemic in some municipalities. Secondly, I feel that data collection systems in slum areas and related informal settlements, they help to sort of identify existing gaps, and also to help the facilitation and coordination of interventions, such as provision of relief materials and government aid amongst various communities within state and also at national level. And thirdly, one of the reasons why I feel research is so important in housing in healthy homes is data collection on the urban fabric through possible city profiling exercises. It helps to access the impact of COVID-19, for example, with the aim of integrating urban planning and management priorities into national recovery strategies. And I feel that in the key areas, these are the key areas really where we have the major backdrop on how prudent, proper housing research is able to provide the related infrastructure and support as we continue to plan for communities in the long term, not only for the next possible pandemic, but just to manage urban population growth and just how we redesign cities for the future.
Thank you very much for that, Kumni. So research is very important. I'm picking a case of my country in Kenya. where when this pandemic came, there was panic, and the government sort of had prepared, but not very well, to tackle this pandemic. But when it came, they just moved to try sort out things with regards to this pandemic without proper research on it. Do you agree with that?
Yeah, I think research is always key. And I keep saying it. A few years past, I think it was in some communities, it was Ebola, it was swine flu. I feel that we need to design cities and always prepare ourselves for what is to come. We see the trend that is happening. We need to watch the way we commute, to watch the way we live, so that as much as possible we are prepared and we continue to gather that information. We see cases where in the urban areas, for example, you have more cases of COVID than you have in the rural areas, maybe in the outskirts, I have had colleagues who travel to Diani and Lamu, and then you realize that in those communities that for some reason you don't have as many cases, obviously maybe because it's not as densely populated as in the city. But I feel this information gathering and this research is paramount. We need to be prepared for the next time, as opposed to being reactive. We need to be able to be proactive. So that's where research and data collection comes very, very handy.
If I hear you well, Kumni, you're talking about that research should proceed before action, and that will mean getting professionals to do this, carry out the research, gather necessary data on how to tackle some of this pandemic. Jacinta from Kampala, how best would professionals and industry policies best ensure that public health measures in regards to management of the pandemic are implemented at the housing level?
We look at things from two different angles, yeah? And there's the long-term aspect, and then there's the short-term, which is pretty much immediate. Like this pandemic hit everyone, nobody was prepared for it. And somehow, we just had to do something. Now, of course, for the immediate aspect, immediate management, it's really about encouraging people to really maximize what they already have within their homes, the aspect of cross-ventilation. We have so many people in homes, and especially when it comes to those, if I could talk about slums, the slum areas, you have windows that are never opened. You have, because of course the spaces are multifunctional. So you find that windows are closed, maybe just a door will be open, and so many things that are really not in order. The environment is very unhealthy, and it's actually conducive to the spread of the disease. So really looking at Uganda, what we did as the architects were encouraging, open up your windows, do this, ensure that there's cross ventilation. But then now, when you look at aspects like social distancing, it becomes a challenge, dealing in certain areas. But then that brings me to the aspect of the long term, How do we manage pandemics like this in future? And of course, it woke us up that, we really need to put our foot down in ensuring that policies are followed through and through. We actually have policies that are good, that are good enough, but there's been a lot of compromise when it comes to actual implementation.
Dr. Susan Kibuye, in your research in the Huruma, what did you discover when you went there about the sanitation, that's the hygiene, wastewater, and all, so on and so forth? What are your comments on that?
When we went to Huruma, there is just one section of it where they have actually worked on their housing and they have made it better. But the rest of Huruma is the same. I mean, it was still carton houses and tin houses. So those places are really very, very derelict. And just as Jacinta is saying, I mean, they don't have houses. They just want a space to live. They just want a space. Some of them don't even have windows at all.
It's 15 hours.
Yeah. So the problem is that it's very dire. So obviously, if you get a pandemic in such a place, it would spread very easily because of those kind of conditions. So they have problems of wastewater. Even sometimes they don't even have the water, clean water for using. And then sewers, they don't have sewers because they don't have proper toilets at all. Yeah, so it's really bad. Then they're very close together. So people are really crowded. I mean, even they stay very many in one little house, and even in the little streets within there are very many people. And also the sewers are open, and people are even walking on top of the sewer. So when we talk about health, hygiene, and cleanliness and all that, it's really a challenge for the people in the slums.
True. Miranda, from what Dr. Kibuye has explained, that some of these areas, the situation is dire, and if the pandemic were to hit those areas, then it's going to be tragic. How best should professionals and stakeholders engage in reducing the risk of unhealthy living environments and neighborhoods?
I think that for a long time, as professionals in Africa, we have tended to neglect the where we've come from. Like, we tend to just adopt the Western means of development. But if you look even in the introduction, we're saying the resilience of the rural communities. What is it that we can learn from the rural communities? What was good about our rural communities? Yes, there's urbanization, but I think as professionals, we can learn something in the way our homes were done originally. As the professionals, we need to go back to the drawing table, just as Kuni said. We need to do a lot of research. And research should go beyond architects only, should go into collaborative efforts. Like, we have planners, we have city fathers from the city management perspective. We need to look at how do we manage our waste. How in the slums, what is the biggest problem? You will find that apart from commuting, the waste management needs to be looked at. So there's need for collaborative effort as professionals. There's need for research into what we can learn from our rural communities. How do we change the house format to fit in the African context?
Thank you very much, Miranda, for that. Probably Dr. Kibuye again. When you're carrying out your research, I'm sure in your research you must have come up with some recommendations. You came up with aspects on how you can advise other settlements, how they can adopt what you discovered in Huruma, in Nairobi. Probably how will these aspects be implemented in existing establishments that may not abide by these recommendations?
Yes, thank you very much for that question, Ambrose. So I'm thinking that we have to go differently in the way we try and provide for housing for people in the cities. And instead of providing for them like a block of flats or just houses, it has to be more. It has to be better planned into like what the Sustainable Development Goal number 11 says about sustainable cities and communities. We have to think about it in a more wholesome manner, that it's planned well, because my colleague is talking about this African kind of a community, but sustainability means, organizing well so that you have green areas within it, that there is access to transportation, that the infrastructure is correct, is there. And also, perhaps, if possible, within those sustainable cities and communities, you can also have the means of livelihood. Because many of the people who flock into these slums is because of economic reasons. Yeah, because in the rural areas, I mean, the agricultural, the agricultural way of life, which has been what people have been doing, is not really sustaining them economically. So that's why many of them are flocking into the cities. In fact, the World Bank says that by 2050, there will be 1.2 billion people in the urban areas. Yeah, and 4.5 million will be in the slums. Yeah, no, sorry, 4.5 billion will be in the slums. So you can imagine, it's not only happening in our country, it's happening all over Africa. I mean, in many other places. So that number just keeps bloating, but we have to start thinking maybe a little bit fast about how we can do better planning of our cities. Better planning of our cities. I think that is key. Yeah, so we bring in the planners, the landscape architects, the architects, everybody on board so that we can get cities that are better managed, and also the communities are together in a better way, not just in my little silo in my house and then I come out, but I don't care about the other person. Yeah. So thank you for that.
Thank you very much, Dr. Kibuye, for that. It's everybody seems to be talking about collaboration, that everybody needs to be in the same page, on the same page when you're talking about healthy homes amidst this pandemic and water. Jacinta, in what ways could professional association partners, professional associations partner with researchers and government bodies to not only tackle the need for housing, but healthy living environments for the public?
Thank you, Ambrose. Ideally, I will actually give an example of Uganda, what is currently happening. So we, as the Uganda Society of Architects, we decided not to sit back and wait for anything to happen. So far, we have seen that government working on its own, in as much as it has some architects within the different entities, there is still a lot of gaps, so many things that are still hanging. So we decided to come up with an initiative that we are actually presenting to government, that, we as architects, we see that there's a big housing problem in the country, and of course, especially in the urban areas. And this is the solution that we want to present. And of course, we're coming up with a project that is going to be countrywide, specifically targeting urban centers, dealing with the shortages, and also looking at improving housing as it is. Now, the problem we have had in Uganda, and I guess it applies in other areas as well, is that whenever there's an interest to upgrade, what they say, upgrading a slum, instead you find a slum is destroyed, and then something new, totally conflicting with the way of life of those people, is put up. And then you find it doesn't address their needs, and they find that it's also expensive for them to maintain. So what we want to do, and I personally have actually done a study.
And that is despite,
I did research before.
Yes, and that is despite the recommendations that you give the government. They still go ahead and do something totally opposite.
What I can say is those before us, I don't know how much effort they put in advising the government, So because we seem to have taken a seat previously, right now we want to come out to the front. I personally have done research in regards to those slum areas and how the architecture is developed, because it's all organic and it's really meeting their specific needs. And it's very space efficient. That is the thing about it. You find very small spaces that are multifunctional. And now you, of course, then what government ends up providing, it's totally different. And so when we look at issues like, say now the pandemic, of course, there's 10 aspects, and one of the panelists actually mentioned something about, we have something to learn from what we have. And it's one of the recommendations that I made, that you don't necessarily have to do away with what you find. There are certain aspects to pick up from there and use them to develop something even better, which will provide for healthier environment, addressing sanitation, proper ventilation, and everything else, garbage collection. So we're coming up with measures, and we want to work together with the government in improving such slum areas without just disregarding what they have. We work together, what they have that is beautiful, and bring in also aspects that make it more healthy, to be able to put up something that addresses their needs and is not necessarily alien to their way of life, but also it uplifts their living standards. So yes, in the long term, it will end up, of course, it will get into policies, because even in Uganda, we have new cities that have just been put in place. That happened in July, because I don't know if you all knew, Uganda had only one city, and that was Kampala. So right now we have more cities that have been put in place. So we're hoping that we will also have a say in the policies governing how housing developments are set up in these new cities, so that we don't see a replay of what we've seen in Kampala, all over the country. So policy also aspects, we are working closely again with the government. It's still a work in progress, but we want to have a voice in the policies that are being set up so that we have better environments. Yes.
Wow, Jacinta. All the best in your endeavors. And it's by coincidence that within this panel, we have Dr. Susan Kibwe. I'm sure you will continue with this discussion after this and travel the journey together, not to mention the rest. And all the best in that. Looking across Africa, I know it's a challenge when you take up a responsibility because you think the government is failing. You, with a lot of passion, you do something about it. But now when you present again to the same government, it's the one that either take it up and do it in a manner that you did not intend, or they just disregard it completely. And I know it can be very frustrating. All the best, and I know you're going to make it. Kumni, what are the expected challenges and opportunities in the housing market in the post-pandemic period?
Thanks for that, Ambrose. I feel there are quite a number of challenges, quite a number of opportunities as well. But I think to summarize the challenges to two major points. I feel the pandemic would cause obviously a significant increase in population living below the poverty line. And we will see there'll be further expected decline in public sector infrastructure investments due to eroding of the government's earnings as a result of increased liquidity issues. Because now we will see the government investing more in healthcare, for example, right? We'll see lost tax revenues. We'll see currency pressures across various markets, as we're already seeing the decline of the local currency against the USD, for example. Second challenge, to summarize, would be shrinking opportunities in affordable mortgages. This is due to the reasons I stated earlier. From experience, government intervention in housing is crucial to maintain affordable price points because the government provides both infrastructure and also provides tax incentives on the supply side, as well as also providing long-term mortgages at reduced interest rates. So some of the challenges we would see also would be that there'll be a housing gap, since this cost will ordinarily would have been subsidized, but now they'll be passed on to the end user. I feel that these challenges are indeed key drivers that would actually cause some, continue to cause where we see the adverse economic effects of the pandemic. In terms of opportunities, I see two major opportunities. I feel the escalation of COVID pandemic in Africa, it indicates the pressing need for more collaboration and more collaborative and sustainable efforts between the public and private sector. I think one of the speakers had also touched on that. We'll also see the impact of the new coronavirus disease could be considerably higher on the urban poor living in slums, where overcrowding makes it difficult to follow the recommended measures such as social distancing and self-isolation. I feel that there are increased opportunities where the government can leverage on relationships in technical expertise through the public-private partnership initiatives. Last opportunity, I'd see opportunities in enhancement of economic recovery for African economies through large-scale housing developments, which is also a significant employer of labor. We're already seeing support from international bodies, for example, like the World Bank, which they're providing affordable housing initiatives and funding for housing projects. So I feel we'll continue to see more play for private developers once those funding starts coming into the market.
Thank you very much. You're talking about support from World Banks and other institutions in future and probably even now as an opportunity. I'll also like to look at it in a negative way when we get this support, a typical African country. Corruption will come out of that. Do you think that's a challenge?
I think that will always be a challenge in Africa. But I from the experiences that I've had, there are a lot of very stringent measures for before these disbursements are actually even made. There are a number of CPs that need to be fulfilled. I feel that you can't totally, the reality on ground in the communities that we live in and being that this is a peculiar, interesting environment, you can't totally and completely mitigate those challenges. But at the same time, I feel that the policies that are in place makes it a little bit more difficult for those issues to actually become a burden on the project. So yes, it's there, but I feel that the requisite CPs, the requisite conditions, and contract documentation documentation that needs to be signed, bill of quantities to confirm exact costs and justification of those costs, disbursements made directly to contractors, and reimbursement on milestones of work done as opposed to paying in advance. So that's where you're reimbursing for work that has already been done or equity that's already been provided by a contractor or developer. So these little plays makes it a little bit more difficult, I would say, to where you'd see some sort of diversion of funds in projects.
I like those measures you're talking about, trying to make it very tight for some of this money to be stolen. These monies which are disbursed to be stolen. And what I can assure you is you'll not be very popular here, and probably any other African country with some of those measures that you're recommending here. You'll not be very popular from either the government side and the contractor side. Having said that, I think we've come to the end of our panel. But before we go away, I'd like to give an opportunity to every panelist who is with us here to give a short parting shot before we wind up. And I'll start over with Miranda from Malawi. Your parting shot, please.
Thank you so much for having me. I look forward to more collaboration, more research beyond just Malawi, beyond my country. But just as we're here talking about these things together, healthy homes, living beyond COVID-19, we should do more for our continent. Thank you.
Wow, thank you very much. Over to Dr. Susan Kibwe, your parting shot, please.
Well, my parting shot is that there's a lot still that needs to be done. And I think we're heading in the right direction. I mean, we've started the conversation and you're going to get there. But very importantly, when we decide to provide housing for people, it's very important that we involve them at any stage of the housing, because that is very important for them to take care of it and also for the housing to be sustainable. So that is very important. Thank you very much for the invitation. All the best. Thank you.
All the best in your endeavors, Dr. Susan Kibwe. Over to you, Kumni Odufuye, for your parting shot, please.
Yeah, thank you so much for that. I think there's a lot to learn in this forum, just seeing, what's happening in Malawi, the conversations, what's happening in Uganda. I think collaborations are very, very important. I think, but beyond these conversations and discussions, it's to see how we can implement and take it back actually into the field and seeing how this can now basically improve the way we design our cities, the way we live, the way we prepare for the next pandemic. People say, God forbid, but we are living in interesting times. And just to learn from the mistakes that we've made and how we can actually have better communities, better societies, affordable housing for all. Thank you so much, man.
Thank you very much, and all the best on your endeavors too. Jacinta Kaburungi, please.
Yes. Yes, thank you so much, Ambrose. Mine is to really encourage the architects out there, regardless what is going on. I think we have the responsibility to actually enhance and uplift the lives of those around in our communities. So whatever architecture we are actually putting forth out there, let it speak a pattern of life that we have that is given to us by God, rather than coming up with something that kind of encourages a division or separation of people. And when I say this, I'm talking about, say, aspects of social distancing. I really have a problem with that in our homes. I don't think that is achievable. So whatever we do, let's uplift the lives of people. We are a communal people. Those are my parting shots. Thank you so much.
My name is Omar Degan. I'm the founder and principal of Do Architecture and Design, an architecture firm based in Mogadishu, the capital city of Somalia. I opened my architecture office around 4 years ago, and when I started work in the Horn of Africa, especially in Somalia, where the context is a bit particular and complicated, I didn't really know which direction to take, and we face different issues in Somalia, from climate change to internal migration, conflict, and different issues, lack of materials, deforestation. So for me, the process of architecture was during the years a constant research, especially in the direction of the most vulnerable, to try to figure it out how to increase their quality of life and in particular how the architecture can support not only the reconstruction but also increase and fight a bit with some of the main health issues that they are at the moment present within the country, and that they are directly related to the lack of infrastructure. My architecture office is specialized in post-conflict reconstruction and emergency architecture mainly, which means that usually I work where there are issues, no matter if it's a post-conflict or if it is a natural disaster or if it is a community affected by a high level of criminality or a lack of infrastructure. So my main practice is exactly directed on the direction of trying to provide a service, the highest quality of service in context where we have a lack of material, lack of infrastructures, and very few possibilities to implement projects in a very expansive way. So what I'm trying to do is always to try to work with the communities, having some sort of participatory planning, work towards the issues within the expert of the community. So I think that my specialization and my work supported the most vulnerable communities and the most affected by these kind of issues, in a sense that I try to always take care of their needs and try to having a deep discussion with them to figure it out how they fix certain issues and where they source the materials. How do they feel about the spaces? How do they manage to live in certain conditions? Because I think that this is the key a bit of every architecture project. So it's not that much related to my specialization or how I approach the work. I think that the main issue is that we as architects, we tend not to listen to the community that we work within, and we just decide immediately, oh, we're gonna just provide this, design this, and for sure it's gonna work. So I think that as a profession, generally speaking, we are a bit arrogant. So my experience in the field of emergency directly affected this way of thinking, moving me from that kind of Western general way of thinking of doing architecture, so moving a bit from Archistar way of thinking to an architect that is on the field and trying to reflect the need of the community. This is why for me working with the cultural identity of the communities that I work with, so trying to figure it out where they come from, how they live, which traditions they have, what affect them, what do they consider a sustainable way of living, why they live in a certain way, directly affect the final result, which means that they will directly have a better home simply because I listen to them and their issue, and I'm trying to figure out how to solve them with an architecture direction. So this is pretty much it, and I think that should be extended on the general context worldwide, and us as an architect, we should listen more and working more in this direction, because I found directly that it affects in a better way the final result of the project. Thank you. The major setbacks, I believe, to provide affordable, healthy homes, especially for the most vulnerable community in Africa, but around the world, it is sadly, but simply the lack of investment and often the condition where you work within. So I think that the general issue can be considered the fact that private sector almost never invest in this kind of projects, and government, local or federal, they generally don't have enough funds to provide that sort of service. So I think that this is the main issue, and usually you ended up working with a very, very low budget that also affect the quality of the design. So this is why I believe that the main source to provide a service in this kind of context without damage or without designing something that lack of the main pillars of good design, it is exactly working within the communities. I don't see any other possibility in this case, because if we put together lack of investment plus vulnerable communities plus eventually complicated locations, lack of infrastructure, and put all together is already built to be a disaster, generally speaking. So I think that us as architects, we should find ways to work in this context with lack of funds, but also trying to show to the rest of the world that providing a system and eventually decentralize the system will also help to reduce certain other issues within the cities, which are, for example, overpopulation, or it can be like spreading of certain disease without certain communities, having a big difference between who is rich and who is poor. So I think that this is one of the major setbacks, so lack of funds. But I think also that, as I mentioned previously, we can find a way to overcome this. For the rest, that more related to technical issues or generally lack of resources, but all of this is manageable in a sense. So I think we should all work to try to move investments in that direction without compromising the quality of the life of the people and without creating gentrification in certain areas, because then otherwise we fail as architects and professionals in that sense. To conclude, I just want to mention one thing that for me is extremely important, which is that cultural identity, as much as biodiversity, should be preserved for present and future generation, which means that if we work toward communities respecting their environment, their culture, where they come from, all these issues that we have on designing healthy homes, they will be reduced, because the communities traditionally and culturally and historically, they already know the issues that the place provide them. They already know most of the materials that are available. They understand how to use that. So I think that us as an architect, we should work more with the communities and try to push the investors and who is in power in the direction to work for the people. Because at the end of the day, architects, we work for the people, we don't work for the money itself. So it is extremely important that we consider healthy homes as the foundation of our own practice, because we cannot even think about providing homes that are not healthy, no matter if you're rich, poor, or middle class. So that's why I believe that this convention, the convention of this year, it is extremely important. And all the participants, they play a key role to provide solutions for different issues that this year, with this worldwide pandemic, they came on us. So I think it is the moment for the architects to start to work with each other, with the community, providing good services. So I'm really, really happy of this year convention. I'm glad for the support that the Association of Architects of Kenya provided to all of us. And hopefully this will be the first step of a long run that it will drive us to better solutions, better homes, and a better environment for who suffer more. Thank you so much.
And I'd like to appreciate all the panelists. I'd like to say that the conversations have started. Hopefully the noise that you're already making are going to get louder. And from there, we'll actually be talking like people who are demanding for the recommendations that you're putting through to be implemented, and that all the stakeholders involved in this topic, provision of healthy homes, must not be avoided, so that we really hit the right targets in trying to achieve this. Over to everybody. My name is Ambrose Ofafa. I am a landscape architect, and I'm the chairperson of the Landscape Architecture Chapter under the Architectural Association of Kenya. Thanks for having you, and all the best. Thank you.